If you look at amputation and the results of patients with amputation, the mortality of an individual patient who has an amputation at the end of a year is probably somewhere on the order of between 60 and 85%. Outside the U.S., there's been over 40 patients who have been treated, and these are patients who have no other mechanism to actually salvage the foot. And if you look at patients who have critical limb ischemia in the stages that these patients are in and cannot be revascularized, their incidence of amputation is probably somewhere in the order of 90 to 100% at a year. This group of patients has been able to have over 70% limb salvage, and that's been dramatic. In the U.S. study to date, 7 patients have been enrolled. In my own experience, I've done 2 patients within that trial, both of whom are less than 6 months out, but have had good return of oxygenation and healing capacity to the foot that we've actually seen to begin starting the process of healing the wounds that they have. So the LimFlow procedures to date have been done in patients who really, without this technology or without some method to improve the blood flow to their foot, would not have been able to heal. And in my own practice, I can say that, and from the patient images I've seen from my European counterparts, I can say the same thing. There's no question that this has improved the ability of patients to heal the wounds that they have and improved the ability to save limbs in patients who clearly would have gone on to amputation. This is, in my view, the first and most exciting thing that's come along in dealing with these patients since the introduction of bypass grafting itself to deal with limb ischemia.